In this presentation, we're going to share with you some information about the Maryland Rural Opioid Technical Assistance Program, otherwise known as MarylandROTA. This project is funded by SAMHSA and currently implemented by University of Maryland Extension as an initiative to address the opioid epidemic in rural areas. You will be hearing from different team members about opioid trends, our goals, our current programs, and ways to become involved in the project. We hope you find the information provided useful. So why do we care about the opioid epidemic? Let's review some national and state opioid trends to get a better picture. As we can see, on average, 130 Americans die every day from an opioid overdose. In the past 20 years, almost 400,000 people died from an overdose involving opioids, and deaths are 6 times higher when compared to 1999 data. So what is our local situation? Maryland ranks in the top 5 for opioid-related overdose death rates, with the largest increase attributed to cases involving synthetic opioids, mainly fentanyl. 75% of the farmers, ranchers, and farm workers reported being directly impacted by opioid misuse, addiction, or overdose. This includes their own use or knowing someone who misuses opioids. Due to the unique stressors in rural areas, such as isolation, restricted social networks, limited community resources, and overexposure to a substance abuse culture, rural residents are twice as likely to overdose on opioids in comparison to urban residents. To give you a more personal understanding of the issue, we wanted to share some personal stories that were captured by the Maryland Rural Health Association, which include the life stories of 3 people who currently live in rural Maryland.
I have been a drug addict for 20 years, living on the streets, whatever I had to do, steal for my clothes, my food. I didn't do the things that normal people do.
Alta presión, la diabetes, todo descontrolado. Habitando en el hospital 15 días, tenía pensamientos suicidas y todo eso porque no tenía apoyo de nada. Era como si me hubieran tirado en un hoyo donde tú, donde quiera que tú mirabas, miras una pared y no tenía por dónde salir.
I was using heroin and pills. Mentally, I was all messed up. Me being pregnant, I didn't want to lose my kid. I just felt stuck.
So what is MarylandROTA? MarylandROTA is a program funded by SAMHSA and is being implemented by the University of Maryland Extension along with the collaboration of different partners. The University of Maryland Extension is a statewide, non-formal education system within the College of Agriculture and Natural Resources at the University of Maryland College Park. MarylandROTA is working together with different departments both within and outside of the University of Maryland College Park. At MarylandROTA, we have 2 overarching goals. The first goal is to leverage the existing University of Maryland Extension programs and system to enhance the capacity of the community to help identify, understand, and respond to the opioid epidemic. The second goal is to serve populations in rural communities throughout Maryland by increasing public awareness, understanding, and skills in order to respond to opioid use and decrease overdoses and deaths. MarylandROTA does this through a multi-pronged approach that will be discussed further in this presentation. MarylandROTA has a core team that manages the day-to-day operations and logistics. More information about our members can be found at our website, MarylandROTA.org. The MarylandROTA project has 3 main areas of coverage, with an educator that covers each of the 3 areas here, denoted by the colors red, green, and purple.
As we mentioned in our goals, we're using a multi-pronged approach to increase capacity of communities to cope with the opioid epidemic. We are currently implementing the delivery of 2 evidence-based programs, Mental Health First Aid and Botvin LifeSkills, by providing training for trainers and delivering the programs to the general population. Over the past few months, we have been delivering the Regrounding Our Response series and the Opioid Public Health Crisis curriculum as part of our technical assistance. To date, we have reached 300 people through our webinars. Mental health first aid certification increases mental health literacy by teaching risk factors and warning signs of many common mental health concerns such as depression, anxiety, trauma, psychosis, and substance use. First aiders are taught a 5-step action plan that empowers them to assist someone developing a mental health concern or experiencing a crisis. More than 2 million people across the United States have been trained in mental health first aid by a dedicated base of more than 15,000 instructors.
The MarylandROTA project has life skill training for middle school-aged youth that is provided with the Botvin LifeSkills training curriculum. Botvin LifeSkills training is a research-based substance abuse and violence prevention program that is uniquely designed to be flexible and interactive for youth. The Botvin LifeSkills curriculum has been tested and proven effective at reducing tobacco, alcohol, opioid, and illicit drug use by as much as 80%. Long-term follow-up studies show that it produces prevention effects that are durable and long-lasting. The current informational sessions provided by MarylandROTA include the Opioid Public Health Crisis Overview Educational Continuing Education Program and a collaboration with the Center for Harm Reduction Services of the Regrounding Our Response series. Both programs are capable of providing social work continuing education credits, and the curriculum from Overdose Lifeline Incorporated includes CE for healthcare professionals of all types.
Additional to the current curriculums that we provide, we also have different webinars that provide information about current research, practices, law changes, and other topics. The technical assistance can be requested for bigger groups, and it can be delivered in person and online. The MarylandROTA website is designed to provide our viewers with easy access to information and resources on the opioid crisis and how it is affecting rural communities in Maryland. Visit our website to learn more about prevention, treatment, and recovery, local and national resources, training, webinars, and events, mental health first aid, and Botvin LifeSkills. When you visit our website, you will be able to look up local resources and access our calendar with community and MarylandROTA events and trainings. The ROTA Network is a virtual community where participants can share and discuss information about emerging trends in opioids, latest opioid prevention and treatment resources, and research and current programs being implemented in rural areas. This network was developed in partnership with the National Drug Early Warning System. Due to the current COVID-19 situation, we have adapted our programs to reach more people online. We have adopted different curriculums, such as the Opioid Public Health Crisis and Regrounding Our Response, to be taught online. We have also developed an online classroom to teach Botvin LifeSkills program to students. We have increased our scope to provide the program as a summer camp throughout the different counties in collaboration with our 4-H partners. Once the online version of Mental Health First Aid is released, we will also be providing that option to those who want to take the training through MarylandROTA. Finally, we have updated our resources to include COVID-19 specific news, and we are sharing updates in our network. You can get involved with MarylandROTA in different ways. Email us at marylandrota@umd.edu to join the network. You can also email us to get more information about implementing Botvin LifeSkills at your school or organization, or to provide technical assistance in your organization. Stay connected. Visit our website for events, webinars, and relevant information at MarylandROTA.org. You can also like us on Facebook at www.facebook.com/MarylandROTA, or email us at marylandrota@umd.edu.